Come in.
Hi, I'm Sherry, and I'm your medical assistant today. Dr. Burt has asked me to administer a tetanus shot. Is that correct?
That's correct.
All righty. Would you please verify your name and date of birth for me?
It's Beverly Heinley, January the 10th, 1956.
All righty, very good. So before we get started, I want to go ahead and give you the vaccine information statement on tetanus. If you will read over that, and if you have any questions, I'll be happy to answer them.
Okay, thank you.
When we pull our medication from storage, that is our first check. While she is reviewing the vaccine information statement, I will do my second check. We always want to make sure that we do 3 checks before we vaccinate or give any medication. Have you had time to read through that?
I have.
And do you have any questions?
No, I don't.
All right, very good. I want to get a consent form signed from you, and I just need to ask you a few questions.
Sure.
Are you currently sick or experiencing a high fever?
No.
Have you had any allergies to medications, food, or vaccine components, or latex?
No.
Have you had any serious reactions to any vaccines in the past?
No.
Okay. Do you have any health problems with your lungs, heart, kidney, or metabolic disease such as diabetes, asthma, or any blood disorders?
No.
And are you on any long-term aspirin therapy?
No, I'm not.
Have you or any of your siblings or parents had any seizures?
No.
Do you have any cancer, leukemia, HIV, AIDS, or any other immune system disorders?
No.
Okay. In the last 3 months, have you taken medication that has weakened your immune system, such as cortisone, prednisone, other steroids, or anti-cancer drugs, or had any radiation treatments?
No.
Okay. In the past year, have you received any transfusion of blood or blood products, or been given any immune immunoglobulins, or any antiviral drugs?
No.
Okay. And have you received a vaccine within the last 4 weeks?
No, I haven't.
Okay. All righty. If you would go ahead and sign for me.
Okay.
Okay, thank you very much.
You're welcome.
Okay, so let me get this drawn up for you.
Now the doctor said something about my age and my cough.
You have a cough?
A little bit, yeah.
Okay, let me go check with him, okay?
Sure, thank you. Come in.
Hi, Miss Heinley, I'm back. And it does look like that he does want you to have the Tdap rather than the plain tetanus. Because you're over the age of 60, you need to have a pertussis booster, which is for whooping cough. Is that okay?
That's fine.
All
Thank
righty.
you. He said something about that, but I wasn't quite sure. Thank
Okay.
you for checking.
No problem. Thank you for letting me know. So I did my first check when I pulled it from the refrigerator. I'm doing my second check right now. Okay. Administering the injection. With tetanus, your muscle can hurt for a few days, so it's better that we use your dominant arm rather than non-dominant because you're forced to use it more. Is that okay?
Yes, that's
Alrighty. Are you right or left-handed?
I'm left-handed.
Alrighty. So let's go ahead and find our location. Go ahead and relax your arm for me. When administering an IM injection into the deltoid, we want to find the proper spot. So we are going to go 3 fingers from the shoulder, or the chromium process, and this is the area that we want to inject. Okay. I will let that dry. Tetanus, Tdap. Okay, for this we will be using a 3 ml 23 gauge 1-inch needle. Peel my wrapper back just like a banana. I want to make sure that I pull down the safety device. I can pull my plunger up and down to make sure it's going to move smoothly. I also want to make sure that I make sure my needle is secure in my lure lock. Alrighty, remember, because this is a vial, you have to give it air to receive anything. So I'm going to give it 0.5 ml of air. Okay. And with one hand, slowly inject the air, and then I'm going to turn that over. Always make sure that your needle stays below water or liquid level. We do need to make sure that we get any air bubbles out. Okay. Again, by holding it at an angle, the air will go towards the opening. 0.5 ml. Okay. I will have my gauze in my hand. For an IM injection, you're going to hold the muscle taut. So I'm going to, at the shoulder, I'm going to put my hand in the shape of a C, and I'm going to hold the muscle tight. And then on the count of 3, 1, 2, 3, and I will aspirate to make sure it's not in a vein, and inject. I will remove. I can apply pressure and massage, activate my safety, and put into the sharps container. I am massaging to help dispense the medication. And then we will apply a Band-Aid. Okay, are you feeling okay?
I'm fine.
Alrighty, very good. I do need to have you wait for 20 minutes to make sure that there's no reactions. If you want to go ahead and get checked out, there's chairs up there for waiting, and I'll come up and check on you shortly.
Okay,
Thank you.